What is medical surveillance for occupational asthma? Have you ever wondered how workplaces keep their employees safe from asthma triggers? Today, we are going to discuss medical surveillance for occupational asthma. This process is all about monitoring the respiratory health of workers who may be exposed to harmful substances at work. The main aim is to catch early signs of occupational asthma or work-aggravated asthma before they become serious. Medical surveillance usually starts with a pre-placement health assessment. This is done to establish a baseline of lung function and any existing respiratory symptoms before a worker is exposed to potential triggers. After this initial assessment, workers typically have periodic health checks, often once a year. These checks can include questionnaires about respiratory symptoms and any work exposures. Lung function tests are also a key part of the process. One common test is called spirometry. This test measures how well the lungs work by assessing the volume and flow of air during breathing. In some cases, immunological tests may be performed to check for sensitization to specific workplace agents. A multidisciplinary team usually conducts these assessments. This team may include medical professionals, occupational health nurses or technicians, and industrial hygienists. The frequency and type of surveillance depend on how much risk is present in the workplace. In low-risk settings, simple symptom questionnaires may be enough. However, in higher-risk environments, more detailed examinations and lung function tests are necessary. The real benefit of medical surveillance is in its ability to detect issues early. If a worker shows symptoms or changes in lung function, they can be further evaluated to confirm if they have occupational asthma. Early diagnosis is important because reducing or removing exposure to the harmful agent can lead to better health outcomes and prevent long-term lung damage. Additionally, medical surveillance acts as a feedback mechanism for employers. It helps them assess how effective their workplace controls are in reducing harmful exposures. If a case of occupational asthma is identified, it prompts a review of workplace conditions to protect other employees as well. While surveillance programs are helpful, many cases of occupational asthma are still diagnosed when workers seek medical care for symptoms. This highlights the importance of workers reporting any respiratory symptoms promptly. Health surveillance programs should include symptom monitoring, not just relying on lung function tests. Overall, medical surveillance is a proactive approach to managing asthma related to work exposures. It acknowledges that specific agents in the workplace can trigger or worsen asthma and emphasizes the need for ongoing monitoring. This is essential for protecting lung health and maintaining a good quality of life for affected workers.